Welcome back to Body Beautiful. Dr. Elizabeth Lee is on the show with us today. We're talking about fillers and other injectables. First, let me remind you that we will be taking your calls live with any questions you have about plastic surgery and dermal fillers. Here's the phone number, 800-440-4884. We'll also be posting the number to the doctor's office during and at the end of the segment. Remember, you always want a second opinion when you're dealing with anything medical. There was a report in the New York Times that said that even in spite of the recession, people are having work done, quote unquote, and while plastic surgery might be down just a bit, fillers, injectables up a little bit.
That's my experience too.
Why?
Well, I would say a couple of things. First of all, it's less expensive than having the facelift, and you can get a lot of good results with that. Although it doesn't replace a facelift if one is indicated.
Gives you kind of a competitive edge in the workplace.
Yeah, and people don't. Nobody likes looking like they're getting older.
Sure.
It doesn't bother everybody to the point where they want to do something about it, but nobody looks in the mirror, sees signs of aging, and likes it.
Yeah, you have a point there.
Yes.
Plus, I'm sure if you're looking at your stocks and those are going down and you say, well, maybe my person is a better investment, and maybe I'll just put it in my face for a minute.
Yeah.
All right, let's go ahead and take those calls. I did promise last break. Let's go to Susie from San Jose. Good morning, Susie.
Hi.
Hi, do you have a question for Dr. Lee?
I sure do. I was wondering, instead of using the Restylane, if you can use like your own body fat to plump up the lips.
That's a great question. Yes, you can. But it's not something that I do very often, and I'll explain to you why. First of all, it involves a second procedure, which is what we call, rather indelicately, the harvest procedure. So you have to do something to get the fat out, which in my office is done in an operating room. So we're now moving into the realm of having surgery as opposed to just walking in and having something injected and being able to go home that day. The other thing is that fat, although it sounds like a great idea because it's your own and you have an unlimited resource of it, or certainly unlimited regarding your lips, it can cause a lot of problems, because when you put fat from your tummy or your butt into your face, it grows differently than facial fat, and you can actually gain weight in your lips or in your cheeks.
Stop it, no.
And it ends up being lumpy, and then it's hard to take care of.
Wait a minute. You can gain weight because if it comes from an area of the body that does accumulate.
That accumulates more weight. And so, and lastly, and this goes into, my feelings about what we call permanent fillers, which is that you put something in the face and it stays there forever, unlike the hyaluronic acids that need to be repeated.
God forbid, silicone,
Well, silicone, but there were other ones that were actually FDA approved and are no longer on the market. But the problem with those is that they don't necessarily grow, but they also don't move as the facial aging continues. So you might have a great restoration in this area, and 2 years later, as the cheeks have descended further, you now have a lump of this permanent filler, and it's really weird looking. So my recommendation is, for a variety of reasons, that you use the fillers that are what we call exogenous, meaning they come from outside of your body, and that are semi-permanent.
All right, Susie, I guess you're sorry you asked, but it sounds like a simple solution, and it's part of your own body. It seems natural, but
and there are some indications for it, but in my practice, relatively few.
Okay, do we have time to take Katie from Redwood City? She's been waiting a while. Hi, Katie.
Hi, how are you?
Great. You have a quick question for Dr. Lee.
Yes. Last week on status post for fillers that I had, Botox and Restylane, and the doctor, for rejuvenation, because I am kind of vain, suggested that I get a peel, THC. What does the doctor feel about peels? I'm 49 years old. It would have 5 days downtime. What does she feel about peels?
What kind of peel was it?
It was a THC peel that she prescribed. It comes 25, 50, and 75%.
A TCA peel.
Right, with 5 days
TCA,
downtime.
okay. I do TCA peels related to the oabgi system. I think that they work really well for certain indications, but when you're in my office, you have to prep your skin for 8 weeks with the oabgi products before we do the peel, because the oabgi skin skincare itself will get your skin revved up and ready to heal without prolonged healing, without what we call hyperpigmentation, which is darkening from the peel, which often is patchy and therefore rather unaesthetic. And so I think peels are great for certain indications, but I would make sure that you're prepping adequately before having a medium depth TCA peel.
All right, Katie, I hope that answered the question for you. We've got to take a quick break, but for more